Hello everyone, welcome back to my channel. Thank you for clicking. So we are still on our weight loss series. We finished that and the workout plan. So in today's video, I look at the medical view on weight loss medications. There are a lot of news that has been circulating in this particular field about these weight loss medications for various celebrities that have used them, and they are available and they are medically allowed. One thing we have to first know is that medically, there are indications we have for someone to use these medications. So, weight loss medications come in for those whose BMI is above 30, yeah, and then for body mass index above 27 with a comorbidity. So, medically, those are the groups of people we're allowed to use this because we know the risk versus benefit, like the benefit outweighs the risk. However, for those below that, we usually suggest that you actually go with the diet modification and then the workout. Yes. Unfortunately, these drugs are abused, commonly abused, and yeah, there is no control so far, but several reports of abuse of weight loss drugs has been noted. These drugs, I'll give us a list of certain drugs that are used, and most of these drugs are approved by FDA. So no worries that maybe what if this drug, by the time a drug is approved, that means it's safe enough for use. And as per the cost, most people worry about the cost. Yes, the cost is sometimes a bit high, but the cost varies in various countries. So in this video, I'm not going to commit on the cost. Rather, you shall look out for these various websites that point out these things. And unfortunately, prices keep on changing. So I'll not commit on that one. Usually, we advise that as we use the weight loss medication, for anyone that is planning to start, they don't work independently because usually you know what happens. At the moment the drug stops, the weight relapses. Yes, relapses are very high. Very high number of relapses has been noted for people who have been using the medicines. That's why we want these medicines to be just an adjunct to diet and workout. So don't use them alone. Let there be that other part. Yes, these things work hand in hand. Otherwise, relapse rate will be very high. At the end of the day. So, moving forward, we are going to look at some of the drugs that have been approved by FDA and how they are used, and such that by the time you're starting, you have a clear picture. I'll list them according to order of efficiency. Which one is the most effective, followed by what. So that's the order I'll follow. So to start with, we have the drug that has been found to be the most effective is tirzepatide. Yes, and tirzepatide exists in brand names so far I know of two, Mounjaro and then Zepbound. So most of these medications are subcutaneous injections. Yes, this tirzepatide, actually, we have subcutaneous injection, which is given once weekly, though some orals may be present. And this medication has actually two major roles. It will help us with weight loss. We expect that, like after 72 weeks, that's about 18 months, we expect someone to have lost at least 5% of their original body weight. And then, in addition to that, it helps us with diabetes type 2. Basically, those are its roles. So that means if your body mass index is 27 and above, and maybe you're living with diabetes, this is a very good drug for you because it will handle two way. It will handle the weight and it will also handle the diabetes. Though there are other anti-diabetic drugs like metformin, those that have heard of metformin, which will also help with weight loss. So that would be an alternative. And metformin, for it, it's quite cheaper. So that means I've mentioned the second drug. Metformin for those living with diabetes and are interested in losing weight. So moving forward, this drug is not completely safe, just like any other drug. There are some side effects that exist. And for this particular one, we are worried about hypoglycemia. The blood glucose may fall too low, lower than normal. And then we are also worried of some gastrointestinal effects, like nausea, vomiting, diarrhea, constipation, depression. So those are some side effects to expect. Though to manage these side effects, we advise that for the gastrointestinal effects, we advise that we opt for smaller frequent meals compared to the large meals. Yes, yeah, it decreases like the chances of the other effects happening, and then it also saves with hypoglycemia. It's hard for blood glucose to fall too low because anytime you're taking it. However, also one thing we need to keep in mind is that some groups are not allowed to take this particular medication. It's not safe, most especially in this case it's pregnant women. If you know you're pregnant, don't take this drug. or before you start this drug, make sure you confirm that you're not pregnant, because it has teratogenic effects. I mean, it will affect the growing fetus. So we need to keep this in mind. So that is tirzepatide or Mounjaro or Zepbound for those that are more familiar with the brand names. So we are moving to our drug number two, and that is semaglutide. So semaglutide, it has around three brands. Yeah, three existing brands. We've heard of Ozempic. Yeah, this has been very common over time. We've heard of Rybelsus, we've heard of Wegovy. So these are three brand names. So all these are brands of semaglutide, which is it's one common agent. So for this one, it's also subcutaneous injection given once weekly. So that just like tirzepatide. Also for semaglutide, actually for it has three things it can help us with. One, it will help us with the weight loss, yes, which is obvious. Then it tends to also, you see, like if you have hypertension, we talked about comorbidity, that existing hypertension, it reduces risk of cardiovascular disease. Like it's hard for you to progress, start getting myocardial infarction or heart attack, all these complications of the cardiovascular complications, stroke. So it reduces risk for that. And also in cases where you've developed heart failure, it reduces symptoms. Yeah, it improves symptoms. In other words, if maybe you cannot, you're breathless on moving, just moving a shorter distance, it may actually improve. Or if you're breathless even without moving, like when you're in a single position, it would help us with improving these particular symptoms of heart failure. So just like tirzepatide, just like any other medication, it also has some side effects. And these side effects are very similar to tirzepatide: hypoglycemia and gastrointestinal effects. So management remains similar, managing the side effects. For the safety, we advise that actually pregnancy still it's not safe. For those hoping to have elective surgery, it usually is supposed to be stopped earlier. Surgery is a period of stress, so we don't want one explanation for that would be like, since it's a stressing state, we don't want want enough glucose levels. We don't want our glucose levels to low, because also this can cause hypoglycemia. So, and with stress comes with further decrease in glucose. So we want to conserve our glucose for this highly stressful state of surgery. So it should be stopped 7 days prior to surgery. And then for pregnancy, confirm you're not pregnant before starting these medications. So basically, that's all about semaglutide or Ozempic, Rybelsus, Wegovy, yeah, all these things. So we are moving to drug number three, liraglutide. So for liraglutide, one of the brands I've come across so far is Saxenda. Yes. So for Saxenda, just like this one, it's subcutaneous injection too, although this one is a daily injection. Now that's what differentiates it from the first two. It's a bit more uncomfortable, a daily injection. The other ones were once weekly. Still, its role it will help us with weight loss and maybe reducing cardiovascular risk. Side effects are very similar, plus how to manage them. And then still, this particular one is not safe in pregnancy. Drug number four, a combination drug, which has two components. It has phentermine and then it has, yes, extended release topiramate. So this is a combination of two components, and one of the brands available, we have Cymia. So still for this particular drug, we help it to help us with weight loss. It helps us with maintaining the weight loss. And actually, for it by the 12th week, we expect a particular at least 3% reduction in weight. Yes, compared to the previous body weight. So this particular drug, the side effects are a bit unique. You need to take note. They're a bit unique in case you're planning to use this or you're using it. Common side effects that have been noted are depression, may get suicidal ideations, dry mouth, constipation, paresthesias, I mean tingling sensations all over the body, so paresthesias. Then you may also get cognitive disturbance like attention. The attention span reduces, such effects. So you need to watch out for these particular ones. Unfortunately, some of these things we may not have an immediate antidote. Yes, so that's why most of these drugs we advise that they should be given to you by a healthcare provider who knows how to taper them. For example, for topiramate, we usually it's tapered in most cases when, because sometimes seizures actually it goes to ahead to even cause seizures. So your medical practitioner will know how best to taper this particular drug for us to reduce these particular side effects. Drug number five, and that is also a two-component drug, naltrexone, bupropion. So This one, for some of the brands available that we've seen on market, we have, yes, Contra. You can see it on the screen. So this particular drug will also help us with weight loss. That is our major aim. And in addition to that, it will give us cardiovascular disease safety. In other words, it protects us from any cardiovascular events that could come about. For example, if you have hypertension, it's the high chances it won't worsen. So in addition to weight loss, these medications give additional what? Additional importance. So it's not just weight loss. And just like the other drugs, for this one they are tablets, yes, twice daily. And just like other tablets, still we expect some side effects. Have headache, nausea, side ideations, constipation. So, and it sometimes it depends on dosing. So that's why I told you a medical practitioner should be in that picture. You should get medical advice, or that leaflet, the medication leaflet should be present on a copy such that you're guided on how best to take it to avoid maybe overdose or underdose. Yes, because I know they want an effective dose that can give us our weight loss. Number 6, we have Olistat. Yes, and Olistat exists also in multiple brands. We have brands like Zenical, we have brands like Ali or Ally, depending on where you come from. These are also tablets taken thrice daily. We prefer during or 1 hour after a meal. So because this Olistat works with lipid metabolism, it prevents absorption of fat. So that's how it works. So we want at a time when you're taking in a meal or after, such that it targets our absorption time, yes, and interferes with absorption. So that just you enjoy your meal, but these fats, excessive fats, are not absorbed. It has majorly three roles. It will help us, yes, with the weight loss by limiting absorption of excess fat. It will help us with reducing blood pressures if you have maybe very high blood pressures, and then it will also help us with hyperlipidemias. If you've been diagnosed with hyperlipidemias, it cannot worsen because of its way of working. However, just because of the way its mode of action, we expect side effects like any fat soluble vitamins, because in our body we have vitamins. We need vitamins, yes. Other than the lipids, we need vitamins. And these vitamins, we have the fat soluble ones, vitamin A, D, E, and K, and then we have the water soluble ones, and those are the rest. So this particular drug, these particular vitamins usually absorbed together with the fat. That means in cases where now fat is being cut off, it's cut off together with the vitamins. So that's why for this particular drug, we add vitamin supplements, yes, this drug. Otherwise, you won't have any vitamins being taken in, and these deficiencies they will come for you. So this is taken together with a supplement. I hope that is clear. So that's why even some of its side effects, it's related to that unabsorbed fat. It will give us flutters, to give us boborejimi, those sounds, abnormal sounds in the abdomen. It may give us abdominal cramps. It may give us oily spotting, clear colored stool, because now the fat is in the stool. So basically those are side effects. There is no clear way to curb the side effects. Rather, it's a bit uncomfortable, but yeah, at the end of the day, we consider benefit over risk. Those are basically the 6 common drugs that you could use. However, there are other options. A single, like phentermine, can come as a single. We saw it with topiramate, but here it can be single. Then we can also have phentermine, yes, coming as a single drug. The ethyl propione. We can have metformin, which I talked about for those living with diabetes. So basically, those are the weight loss medications. You can look out for the course, and in case you're suffering BMI above 30, BMI above 27 with a comorbidity like hypertension, diabetes, and hyperlipidemia, this is the best approach for you, because this body mass index comes with a lot of health effects where we may not be patient enough to wait for diet and workouts. Yes, so basically that's what I had to talk about in this video. I hope it's of importance, and I hope it gives you a clear picture of weight loss drugs. In case of any questions, kindly type them in the chat, and yeah, let's continue interacting. Thank you so much. Kindly subscribe to the channel, like the video, share. Thank you. Goodbye.